So I know you're feeling it kind of in this area here.
Yeah, right there.
And this has been going on for how long?
Noticeably, it's been going on for probably about like 4 years. I was in nursing school, so I was sitting a lot.
Relax the pedal. There you go. Nice and easy on that. Good job. There it is. Hey, yo. Does it also occur on the left or is it just on the right side?
It does sometimes occur on the left, but it is predominantly more on the right side for sure.
And this has been going on for how long?
Noticeably, it's been going on for probably about like 4 years. I was in nursing school, so I was sitting a lot.
Yeah. Yes, I can see that. Yeah.
But it's been going. I mean, it's been going on probably longer than that. So.
Okay. Is it going down into the legs or is it just localized there?
No, it's just pretty localized right there. But I know my hamstrings are really tight.
Got it.
I went to physical therapy.
Yeah.
And he told me to do hamstring stretches. And
yeah.
My hip flexors are really tight too.
Yeah, so especially, you can get what's called, have you heard of a lower cross syndrome yet?
No.
Lower cross syndrome is basically where you'll have really tight lower back muscles and you'll have really tight hip flexors, but you'll have a weaker core and weak glute muscles. And so a lot of times,
that's what I have.
yeah,
That's what it sounds like.
Yeah, it's one of the most common things that I will say occurs in our lifestyle, in our society, just because, like you said, if we're sedentary, sitting at a desk while we're in school, a lot of it comes from, I think, when we're kids and in school. And as we're studying and as we're in class doing homework, whatever it is that we're doing, we're sitting way too much, so we're sitting in school, we're sitting at home watching TV, we're sitting at the dinner table, like we're just sitting nonstop. And so unfortunately that develops these patterns that we will see very, very often. And so because of that, it will create stress onto your spine. And when that happens, you're going to see a lot of this stuff with your joints, aggravating it, but a lot of this stuff doesn't occur until we're older. Sometimes patients come in and the pain may have started like a couple of weeks or a few months, and they're like, yeah, I just started like a few months ago. Well, that doesn't mean that that's when the problem started. So I'm going to put some pressure onto the spine. We do got some specific areas that we're seeing that's creating some stress where there's inflammation. So when I push into the spine, if there's any pain, soreness, or tenderness, let me know right away. Okay? So right onto this right side. This is the upper joint, middle, and we got the lower. Any pain there? Upper, middle.
A little bit in my middle, yeah.
And then the lower. Not too bad down the bottom. All right, I'm gonna push into the center here. This is your sacrum. This is S1, S2, S1, and then we got L5 right over here.
L5 is a little sore right there.
Yeah. So looking at your x-rays, you can see the L5, how it's kind of kinked to the left, and it sends your spine to the left side.
Okay.
What we can oftentimes see is that when your spine leans to that side, it creates a bigger of a wedge on that right. So there's a lot of inflammation on there. So I know you're feeling it kind of in this area here.
Right in there.
I do believe it's your L5 that's going to be contributing to a lot of that stress here.
Right there.
Yeah. Yeah, that's the spot. That's the spot. I'm press onto the mid back here. This is T7, T6, 7, 8. Any pain there?
A little bit.
Okay, which would you say is the worst? 8, 7, 6.
7.
One on the bottom, one down below right here. Do you usually get mid back pain or is it just your lower back that you realize?
I do get mid back pain, but it's more my lower back.
Okay. Let's take a look here. So both on the scan, but looking at your x-rays, we definitely have some stress on your neck here as well. Okay. So I'm looking for the range of motion here because it should be moving much better down below here. So this one, it moves just a little bit. That's your C6 right here. One above it's going to be your C5. 6, and then we have 7 right here. So 7 doesn't want to move the way it's supposed to. Compare 6 to 7. 6, 7, which is
7 on the outside feels more.
But when I push onto the 6, what do you mean?
I can still feel it. Like it still feels a little painful, yeah.
Okay, so 6 is actually moving okay. I'm not too stressed about that one yet. But your 7, when I'm tilting your head back like that, it should dip a little bit better here. So it's stuck. So it's not wanting to budge there. So that can contribute to some soreness within that C6. But we're going to start with your C7 to get some mobility in there.
Okay.
And then if we have to do C6 later, we can. But we are going to work on your C7. Because looking at your x-rays, so one thing that we're going to see, so your L5 here, you see how it's kind of wedged on that side?
Yeah.
It's kind of pinching on that left here. The inflammation where that disc is kind of swollen here is going to cause that pain on that right side.
Oh, okay, gotcha.
And it sends your spine to the left, and then your body compensates to kind of get you back into the center here. So it starts to work its way back into the middle, but right about that C7 area here, it's kind of kinking back to the left again, sending you back to the left, right?
Okay.
So that's why you're going to see some of that pressure again on that T7. But then you do have that stress on that C7 here as well. So you have T7, you have C7, and we're going to see some stress here. So that neck, I can tell you have some stress here. You see that little sharp, jagged, I call it like a bird's beak. So that's the bone spurs that are developing just because of the when there's stress, your body will create a new bone to compensate for that stress. So there's definitely a significant amount of stress happening down on that cervical spine here. One thing that you're going to notice, you should have a good curve going on here, but this is going to be 1, 2, 3, 4, 5, 6, 7. So at that C7, that's where it stacks the spine straight up here. From here, it's tilting forward, and so you're going to see that it's going to create that stress in the front here, but it starts from the bottom. So if we can get mobility here, pushing that spine forward, that will create more stability here and hopefully get your head to come back a little bit better, okay? But we got some work to do. So let's go and get started. Let's get just some adjustments, and we'll see where we go from there.
Okay.
Okay, sound good? So let's go ahead and get that C7 here, and let's get you moving here, and you're just going to relax the head here. I'm bringing you down just a little bit more, get you nice and relaxed. Right there's perfect. A little bit more of a push, let it go. Nice and easy on that. Not too bad? A little sore?
A little bit, yeah.
Okay, yes. Yeah, there's some swelling in there, so hopefully getting more movement in that joint is going to help to pump out some of the inflammation within that spine, and the adjustments will feel a little bit less stress from there. Okay? Scoot on up just a little bit. Okay.
So if I crack my neck, is that bad?
Terrible. Yes. Scoot on down just a little bit.
That's good.
So it's not the same as like popping your knuckles, right? If you crack your knuckles, like a lot of people are like, oh, you're gonna get arthritis, blah blah blah. It's not gonna be the worst thing if you crack your knuckles. The problem is when you crack your neck, what happens is you have a lot of sensitive tissues with the nerves and the fibers in there. And so if you chronically crack your neck over and over and over, the question always comes into is, are you cracking the right joints? And are you moving them in the right direction?
Okay.
And so if you're not doing those things properly, then it could potentially make things worse. And so a lot of times people feel more and more pressure within their spine. And so because that pressure builds up, they feel the need to crack their neck. But the joints that oftentimes move are the joints that are hypermobile. So the joints that are stuck, they're really hard to move. And that's why we have to be very specific with that. But when you crack your own neck and stuff like that, you usually adjust or crack the joints above it and below it, and they become hypermobile, and then they can wear a little bit more.
Oh.
Yeah.
Okay.
So
I should stop that.
Yeah, I recommend that. Scoop forward just a little bit. There you go. So we're gonna get that L5 right on over here. And so from here, I'm just gonna go a little bit of a pressure. I'm gonna go and rest my leg right up against your leg here, and a little bit of a push here. Okay? Let it go. Nice and easy on that. Good job. Go and have a seat coming up. Let it out. Relax that shoulder on the right. Try to let it go. Okay, one more time. Breathing in. Deep breath. And let it out. Relax the belly. A little baby one. Alright, we're going to take that. Good adjustments today. We definitely got some work on that mid-back. Everything else started moving really, really well already, so I'm pretty happy about that. But let's go ahead and talk about what we just did, because we just did the L5, we did your T7, and we did your C7, right? Basically, again, that L5 is the foundation of your spine. It's going to be the one that's causing a lot of the pain that you're experiencing on the hip. The good thing is right now it's localized, and so it's not shooting any pain down into your legs or to your feet. So when that nerve gets really irritated, you can aggravate the sciatic nerve, and that can cause more problems, right? So right now you're just having localized pain, which is really good, which tells me we're catching it a lot sooner, right? So our goal is to try to get you back more to midline to create more stability, not just for your lower back, but it's going to create more stability for the rest of the structure, okay? Which will also help your T7, but also help to improve your neck, okay? Now your neck, because it's been this way for some time, that's going to take some work to try to get some curvature coming back in. The good news is that you still have a lot of disc spaces within your spine, which means that there's more room for improvement. Okay, so I'm hoping that we can get some good progress. But with that C7 creating more mobility, hopefully that will help to create the trend for your spine to come forward here and take off some of the stress on the front of your spine. When there's that stress on the front, the bone spurs that develop, that's more permanent damage. I can't reverse that. But if I can create more stability within the spine, that will either slow down or prevent the progression of that degeneration from happening. Okay.
Awesome.
Well,
Thank you.
Good to see
Pleasure.
you. Pleasure.
Nice meeting you.